I hope you all can see. Perhaps Wulan and or
Yeah, it's
Liam
clear. It's coming
Okay.
through. Yeah. Thank you, Neil.
So this course, we have divided it into sessions based on topic. I will start off by talking about the importance of entomology in public health, like why it's so important for us. And then today I will also talk about the ESPT, which Leo introduced briefly, which is the entomological uh, sampling planning tool, as well as introduce a really important concept of gaps in protection. And then we'll start looking through how to develop and implement a good entomological surveillance. So I'm going to start if this changes slides. Yes. Now you all know the answer to this question. I'm sure you all know. The world's deadliest animal, right? Is besides humans, is mosquitoes. They kill the most number of humans on this planet. And just by that, we should realize that, hey, we need to figure out what's happening with mosquitoes. Now, when we look at malaria, because we are using malaria as a use case here, and a bunch of us work on malaria, but please bear in mind that if you have other diseases, if you're working with other vector-borne diseases, all the principles and concepts and the thought structure, the logical framework that you can use for malaria, you can absolutely use it for any other disease by breaking it down into the stepwise sort of methodology that I'm going to go over. So with malaria, you can see that vector control has been associated with a huge decrease in malaria worldwide. It's an estimated that vector interventions have averted about 663 million clinical cases since 2000. And bed nets are the ones that have actually were the largest contributor to this, about 68%. And on the right, you can see a picture of the countries and of the amount of malaria in 2000. And all of them, almost all of them, you can see it's gone down until 2015 when this was published. So you can see vector control interventions have actually caused a huge and dramatic drop in malaria worldwide. Uh, so the main question now, this is an important concept to me. Uh, why are vector control interventions so important, right? And weirdly, it's not because they just kill mosquitoes. It's because of mosquito age and malaria. Now, if you think about it, humans, the death rate in humans goes is really high when we're little children and when we're really old. However, in mosquitoes, it remains about constant every day. About the same number of mosquitoes survive from a cohort of mosquitoes. They about the same proportion survive every day, and it's about 80%. Now, think about this. If Plasmodium, if the malaria parasite, takes about 10 to 14 days to mature in mosquitoes, that means the mosquito is only infectious to humans after that 10 to 14 day period, right? Because before that, the malaria parasite is not mature in the mosquitoes. So, thus, old mosquitoes are more infectious. And this is sort of counterintuitive to death, but let's look at it in a picture and just so that it's a lot more clearer. Now imagine that the survival rate of mosquitoes is 80% every day. So 80% of mosquitoes survive every day. So on the left, we have the number of mosquitoes, and down here, we have the number of days from 1 to 22 days. So on day one, if we have 1,000 mosquitoes, on day two, 80% would survive, so there'd be about 800. On day three, about 80% of those would survive. On day four, about 80% of those. So now, if you think about how this functions, and let's say every single mosquito bites me and I have malaria, all those 1,000 mosquitoes, and every single one of them gets infected with malaria. We know this is probably not true in reality, but let's assume that all of them get malaria. Malaria now takes 10 to 14 days. The parasite takes 10 to 14 days to develop. And only after that are they infectious. So the mosquitoes that can actually have the potential to transmit malaria are the red ones at the end. And you can see on each day, that's a lot less than the 1,000 original mosquitoes. So now, if you imagine, if you add up the number of mosquitoes in every day, you can see that with a daily survival rate of 80%, in this 22-day period, we have about 4,963 mosquitoes. And only about 392% have the potential of giving us malaria because they're old enough, right? Now, if you imagine that about 10% actually got infected with malaria, you can imagine that how this 392 is not, the number of infectious mosquitoes will be less than 392. So overall, about 8% of this total cohort of mosquitoes across this whole figure can potentially give us malaria. Now, let's look at an intervention. Let's say we have an intervention that reduces the survival rate from 80% to 65%, and that's 15% reduction. Now that we see over here, which is the green. So the 80% in blue is what we saw previously. And the green now you can see that even though we had only a 15% reduction in life expectancy, look at the red. These are the potentially infectious mosquitoes compared to this orangish color here. It's not 15% less, it's drastically less. And you can see how by reducing the survival rate just a little bit by 15%, you've had a huge impact on the proportion of potentially infectious mosquitoes. It's gone from 8% to 0.8%. And now you can see how just a vector intervention that decreases the survival of mosquito has a gigantic impact, can have a gigantic impact on malaria. Now, what happens if we have an intervention that has a huge impact on mosquito survival? And that would be this light blue over here. Let's say it's 50%. Now, all of a sudden, you have almost no infectious mosquitoes because none of them survive that long. And now with the 50% survival rate, you have zero point 0.9 mosquitoes out of a total of 2,000. Not only have you reduced the overall mosquito population, but only 0.9 of them, not even a whole mosquito, is potentially infectious. And that's 0.05. And so this is basically why vector control interventions are so important. So understanding how they function, why they function, which mosquitoes they function, is really important for us to be able to combat disease as well. So these interventions can be WHO recommended interventions like adult interventions like bed nets and IRS. IRS stands for indoor residual spray. Apologies for putting that in the questionnaire without explaining that. Someone asked that question. So IRS is indoor residual spray. And both these interventions work on adult mosquitoes. And hence you have this big impact on the older mosquitoes and transmission. Now, what happens when we look at larviciding? And this is an important comparison because the difference is actually quite big. Now, when we look at larviciding, what happens is we basically take the number of adult mosquitoes and drop them, right? So instead of starting at 1,000 mosquitoes, let's say you impact 50% of the adult mosquitoes. You'll start off, instead of starting at 1,000, you start off at 500 because larviciding doesn't impact adult mosquitoes, it only impacts larvae. It basically doesn't have an impact on the age structure or the survival rate of adults. And this is what happens. So if you look at the 80% adult survival rate, what happens when you put larviciding over there? Now with larviciding, which is this crosshatch, you start off at at 500 instead of 1,000 because you've killed off all those larvae. And you can see here that the survival rate of these adults is 80% as well because you're not impacting the adults. And now you can see here, even though you've dropped the total number of adults, the potentially infectious proportion is about the same. It's about 8 as the normal cohort of mosquitoes. You've just dropped the total number, so it gets halved. If it was 60%, you drop it by 60%. If it was 40%, you drop it by 40%. So you can see how uh, uh, larviciding impacts your transmission or your potential to transmit the proportion of mosquitoes that can transmit malaria differently than an adult intervention. Either way, your potentially infectious proportion would remain the same with larviciding. And now let's map your adult intervention to your larval intervention, and you can see the difference, right? So they are 80% normal survival. This is your 65% survival with an adult intervention. And even though you had a 50% impact on adult mosquitoes, your larviciding also has an 80% survival of those 50% of adult mosquitoes. And you can look at the infectious proportion here. This bright orange is your normal, the crosshatch yellowish is your larvae, and your red is your adult intervention. And you can see the difference. So when you are selecting an intervention for your site, uh, keep in mind how your intervention works and what mosquitoes are they working on, larvae or on adults, and what your eventual goal is. And obviously, that is why larviciding, this is one of the reasons why larviciding is considered a supplemental intervention, even though a lot of people use it as a primary intervention, because your impact remains the same on adult populations as it normally is in the adult population structure. I hope that was clear. I wanted to talk briefly next about mosquito behaviors and intervention. Why are mosquito behaviors important? Oh, and as a quick note, if I end up talking too fast or if I don't explain something well enough, please put it in the chat and Leo will be looking through these things and can shoot me a message and tell me, Neil, please slow down, or Neil, please explain this again. I'm happy to do that. So mosquito behaviors and interventions. Why is this important? Now, if you look at this little,
Neil,
yeah,
sorry. There's one question here that's been niggling me, and maybe people are saying, how is the survival rate calculated? You were saying in that graph of yours. So maybe just a quick response to the
ah,
question. How is the
so
survival rate calculated?
survival rate can be calculated a couple of ways. One of them is parity analysis, right? You can do a parity analysis of newly emerged mosquitoes versus mosquitoes that have already laid eggs. You can also do dissections. And with the dissections, it's really complicated procedure where you actually count the number of gonotrophic cycles that the mosquito has been through. And only a few people in the world actually know how to do this well, and I do not. You can actually dissect it and say a mosquito has been through like 12 gonotrophic cycles, and at 2 to 3 days per gonotrophic cycle, you can actually calculate their age. And the survival rate of 80% was actually done quite a long time ago and calculated for Anopheles gambiae in Africa. And we are using that number right now for these fingers because that's one of the only numbers we actually have. If anyone would like to produce this data to figure out what the survival rate is at their sites, that would be really great. We have a little bit of data from parity analysis from Indonesia that demonstrated that the mosquito populations at our sites actually, the survival rate was 85%. So about 80%, but it was higher than that of Africa. I hope that answered the question, Leo.
Yes, great. Thank you, Neil. Thank you.
Okay, so mosquito behaviors. So if you imagine this little scene over here where we have all these little orange mosquitoes flying everywhere, and you have people indoors, you have people outdoors. And now we know, and this is really true from a few sites, that there can be multiple species here. So let's say species one likes to feed outdoors, species two likes to feed both indoors and outdoors, and species three feeds inside, right? And we see this across the planet where different species have different behaviors. They will feed on humans inside and outside houses, as well as just they prefer to feed inside. Now, how do interventions work? A vector control intervention takes advantage of a susceptible mosquito behavior. So if you look at bed nets, for example, or ITNs or L Alliance, bed nets function on human and indoor biting mosquitoes. If your human is outdoors, your bed nets don't work. If your human is not under your bed net, like this little child is sleeping with the bed net right next to her, the bed net's not going to work against that human. And so you have to overlap with how the intervention functions, of course. So bed nets work on human and indoor biting mosquitoes, and IRS, or indoor residual spraying, works on indoor resting mosquitoes. If your mosquitoes do not rest on your sprayed surfaces, your mosquito will not be affected by IRS, right? That totally makes sense, right? So now let's look at this situation where we apply these interventions to that area where that three species of mosquitoes. Now let's say we apply the intervention right there, whether it's IRS or bed nets. The black space is where your intervention is going to be effective. Everything outside that, your intervention is not going to be as effective because those mosquitoes don't necessarily sit on your bed net. They're not impacted by the insecticide. They don't sit on your sprayed walls. Well, against species three that loves to feed indoors, It works pretty well on species two, that is indoors and outdoors, because some of the time that mosquito will go indoors and perhaps will be impacted by the bed net or the IRS. And species one basically remains much less affected or not affected. And these species, species one and two, can potentially continue transmission, right? So at every site that has IRS and bed nets, all the mosquitoes that are transmitting disease and all your infections you see are basically infections that happen outside the protection of the interventions. And I'll go over that in a bit as well. So species-specific behaviors, right? Malaria transmission is determined by local vector species, obviously, because you don't necessarily have species from one country affecting species from another unless you have an invasive species, which is a completely different subject. Uh, Different species have different behaviors, obviously, as we know that. So species-specific behaviors and compositions. So at your site, the specific species you have, their behaviors, and the compositions of them, which species and their behaviors, will affect how you sample your mosquitoes, because sampling also takes advantage of mosquito behaviors, and I will talk about that in another presentation. It affects where and when malaria transmission happens, as well as the potential of an intervention. So your mosquito behaviors are superbly important because that tells you where your transmission is happening and how well your intervention works. It also will tell you, and we'll work through this later on, what intervention has the greatest potential at your site, because you want to look at your mosquito species and their compositions and their behaviors. And based on that, you can map which intervention will work best there. And that is where entomological surveillance comes in hugely. We can also look at the effectiveness of an intervention, as I just said. So when an important concept is gaps in protection, and I actually have a whole presentation on this right after this presentation. So as we just talked about, vector control interventions target species-specific behaviors, right? Interventions protect humans from mosquito bites only when the human behavior and the vector behavior that are targeted by the intervention, when they overlap. So let's say we have an intervention here, let's say it's bed nets, right? And it overlaps with both humans and vectors. I'm going to back that up and repeat that again because I think I went through it in the wrong order. So human behaviors and vector behaviors, they overlap. And where they overlap, we get transmission. Let's say your mosquito bites a human inside their house and the humans inside the house, that's where there'll be a transmission event. Now you put your intervention there, and where humans, vectors, and the intervention overlap, that's where we get protection. So a human is under their bed net, inside the house, where the mosquito comes to bite, you will get protection. Your human is outside without a bed net, but it overlaps where the mosquito is biting, you will get transmission. The human is inside the house without the bed net, and your mosquito is biting there, you will get a transmission event. An infected mosquito, of course, not any mosquito. So you can see this sort of figure, it sort of is really important to understanding where and when you can actually protect people and where and when you could have continued transmission. And understanding this at your site, this simple figure of how your local humans interact with your local vectors, along with your specific intervention, will tell you where you're protecting people, how much you're protecting people, how to optimize your intervention, as well as where your malaria is coming from, because that's your gaps in protection. And that will tell you what other interventions you might need or what other strategies you might need. So the importance of entomological surveillance. So all of this can be understood by entomological surveillance. So through entomological surveillance, you can understand what is driving your transmission, which species of mosquitoes, where is this happening, when is this happening, what humans are how humans are contributing to do it, to transmission. You can understand the potential of an intervention. If you don't have interventions, you can figure out what is the best intervention to select for your site. For example, if all your mosquitoes are biting outdoors and none of them go indoors, a bed net is probably not the best selection. If all your mosquitoes rest outdoors and none of them rest indoors, IRS or indoor residual spraying is probably not a good selection, right? You can also tell through entomological surveillance how well your intervention is working. And once you find out how it's working and how it's not working, you can figure out how to optimize your intervention. You can actually, as I just said, you can understand how your interventions are not working, which is your gaps in protection, which will explain where and when all your residual transmission is coming from. And this is really important. Entomological transmission will help you monitor changes in your system. Because imagine this, we are fighting evolution, right? Because when you've seen insecticide resistance come up at your sites and across the world, that is evolution. When you place pressure on a system, it's going to push back. And we see this with mosquitoes a lot. So we want to monitor these changes in the transmission system, and I will go over that as well, because we want to see how to respond to it, right? We want to respond appropriately to protect our people. So that is the end of my first slideshow. And I was wondering if Leo, if you had any questions that would be ready for me, or should I continue to the next?
Okay, so Neil, since you're offering, there was a question here, and I'm too busy reading, so I can't, I can't remember what exactly it related to. But what do we mean by normal intervention? Is it a combination of both adult and larviciding interventions? Can you remember the context, Neil?
I don't remember the context, but if you mean maybe I wouldn't say normal intervention. If I said that, I probably made a mistake, and I apologize for that. I would say a recommended intervention. So WHO at present recommends bed nets, IRS, and larviciding as LSM as larval source management as a supplemental intervention. And I would consider those, if we were going to call them normal, could consider them normal, but I would say recommended interventions.
Can I ask you one more question, if you don't mind, Neil? Does the percentage of the survival rate, is it affected by human behavior?
Depends on the intervention. And for example, with IRS, the human behavior that would impact IRS would be if they sprayed the walls well. So yes, in that respect, yes. If, for example, humans are under their bed nets a lot and more mosquitoes are going to the bed nets because all the humans are under the bed nets, they would be greater impacted by the bed nets. So in that respect, yes, as well. But I don't think anyone's really, or I haven't seen any studies or data specifically on that.
All
Uh,
right.
yeah.
Okay, sorry, carry on, Neil.
I was going to say human behavior does impact how effective an intervention is, as an intervention use. Like if they use the intervention well, if they're under the bed nets, if they spray the walls well. So it does impact that.
Correct. Can I just say to everyone, we're harvesting all your questions, but there are so many coming in. We cannot ask Neil to answer each question and also lecture. So we're harvesting all your questions, and at the end of the course, we'll spend several days to try and respond to each of those. But, we can only try and answer a few of the more uh, key questions. So please don't get upset that we're not addressing your question. We will get to it, but there are just too many coming in. So
Yeah.
we'll deal with it at the end of the course. Please continue, Neil. I'm going to stop in about 10 minutes.
Okay, sure. So I will now have my talk, once it opens, is on the entomological surveillance planning tool. I wanted to go over that. Uh, So what is the ESPT, the Entomological Surveillance Planning Tool? So what happened was a couple of years ago, we all know that WHO has really great recommendations and manuals and advice for all of us, and really, really good recommendations based on crazy good data. And that's what they require to make these recommendations. But the recommendations are very general and they're applicable, but it requires a lot of planning and thinking and trying to make and adapting them to your specific needs. So how we had a lot of requests from the Malaria Elimination Initiative at UCSF, who I'm also working with, for hey, how do we apply WHO recommendations to my system, to my needs, to my questions? How do I make it applicable and most useful based on my limited budget, right? Because no one has millions and millions and millions of dollars to do everything that WHO recommends or that they would want to do. So we put together this ESPT, which is a decision support tool, right, for planning entomological surveillance. It also helps with interpreting the data and also guides programmatic vector control decisions. So even though the ESPT is directed at ministries of health for programmatic use, please note that as I mentioned earlier on, the systems and the logical framework is applicable to anything. I actually use all this for my academic research when I'm looking at a grant or developing a grant or the analyses. I look through the same framework to get a study organized and trying to figure out what to do within a research grant. So I use the same thing, and it's completely applicable to most any process if you just work through the logic. The nice thing is the ESPT aligns with what WHO says. We use all the data what WHO says and what they recommend, as well as global other bodies like PMI, like the President's Malaria Initiative. So we worked with them to develop the ESPT. It is question based. And I think this is important, and I'm going to touch upon this more later on. We collect so much data, so much entomological data, but how much of it is actually used for decision making? We are wasting a ton of money, a ton of effort, a ton of capacity when we don't use the data instead of using it in a focused way that's actually effective in creating change on the ground, right? The ESPT also supports use of multiple types of data, not just entomological data. Because malaria, for example, is caused by mosquitoes, we're doing vector control and vector interventions, but there's also the parasite, there's human movement. There's a simple example is if a person doesn't use their bed net, it's not effective. And what's the important thing there? The person, the human drivers of protection and the human drivers of infection. So we have to incorporate humans as well. And I'm going to be talking about that later on. So the objective is gap filling for operational guidance. So how do we apply global guidance, WHO guidance, to our specific context, right? A key point is it uses minimal essential indicators. So we don't have to collect all 40, 50, or how many indicators that anyone recommends. There are a ton of indicators. You can collect a lot of data. What we actually need is the minimum amount to answer our question that saves us money, time, resources. It just is a better way of going about things. And with this data, to answer our question, we can actually collect data that is actionable and make evidence-based decisions. And evidence-based decisions, as you know, are better than opinion-based decisions, right? And also, an objective is to integrate multiple kinds of data, as I mentioned, like human behavior with entomology, epidemiology, and so on. So MPAC, which is the WHO Advisory Board, they said, and here's for context, that there is underlying heterogeneity in malaria risk, right? And we need the problem-solving approach. We can't just have one system to apply to everyone. So how do we understand what is the most appropriate intervention or intervention packages for my country, for my area, for my study, right? How can we be flexible in implementation? How do we select this? And based on this, we developed the ESPT. How do we take this common global guidance and make it applicable to my site to answer what I need, right? And you can, as I mentioned at the beginning, you can use, even though the ESPT was made for, and it's program oriented, right? You can use it for multiple things, right? You can look at the potential of interventions. You can use it to evaluate interventions. You can understand your gaps in protection, where your residual malaria is coming from. You can use it to optimize your interventions. You can use it for planning. What I've seen people do is sort of develop a perfect budget, a perfect plan, entomological surveillance plan, and then go to their boss and say, this is my perfect plan. This is what I want to do. This is the budget I need. How can you give us this budget? Right? So use that. I've seen it used for national strategies. You can use it for global fund applications to understand what you need, right? A whole bunch of things. I've even seen a country use it to develop a list of things they need. What is the gaps in our capacity? And they looked at it from an infrastructure point of view, from a personal point of view as well. So it's basically you have a question, you have a problem. This is how you would ideally approach it. And the outcomes can be multiple. Like you can look at it, the outcomes from multiple perspectives. So how does it work? So it is question based. And I have a presentation on this because having it being question based is a key point. What is your question? And I've said this, I think, way too many times to people like, what is your question? What are you trying to answer? Right? We look at mosquito behaviors and interventions and how they function together. And I went through this on previous slides, right? How do interventions function? How does a specific intervention function? How do your vector species behave at your site? And how do they respond to each other? Right? And over that, we overlay what humans are doing, right? And that's the simple concept of how the ESPT functions. What is happening at my site? What will work there best? How do we evaluate it? We also want to use minimal essential indicators, which is the least amount of data we need to answer the question well. And that's important because it saves so much funds and resources, right? As well as I said earlier, metadata. And that's other kinds of data that help with the decision making, that help with understanding what's happening. So this is a very brief overview of the ESPT. These are the steps, and we'll have presentations in each of these steps. So imagine the first question, and I'm going to be saying this a lot. What is your question? Now you have a question. The next step is, what indicators will answer my question? What data points do I need to answer my question? And there are two kinds. The first kind that we want to focus on is the minimal essential indicators. And if you have a ton of money, if you have millions of dollars, which I wish I had, at that point, you can have nice to have indicators, right? Add-on indicators that are nice to have, but not absolutely essential. So what are the indicators that answer your question? The next point is, what are the sampling methods I need to use to collect the indicators to answer my question? And then what site should I use where we'll implement the sampling methods to collect my indicators that answer my question? And then what is the sampling design I will implement, right, at the site with the sampling methods to collect my minimal essential indicators to answer my question. And at this point, the sampling design point, we will have this ideal, perfect, most applicable plan for my question for my site. And then we look at capacity and funding. And a lot of times we don't have enough. And we'll go back to the question to say, do I have to re-ask my question? Can I take out some of these indicators? Can I use a cheaper sampling method? My sampling frame, instead of doing 20 houses per time, maybe I should just do 5 and then redo the budget and capacity until you get a plan that actually fits within your capacity and budget and actually answers your question. And I'm sure like 95% of you all are saying, this is common sense. And that's exactly what this is. How do we apply common sense to entomological sampling to get the best data we can within the budget we have to answer our question, to make the best decisions moving forward and protecting our populations? So in the ESPT, there are also decision trees. Now, what is a
Neil, I'm
Yes, yes,
sorry to interrupt.
yes. Not
Since you're starting on a different, I just want to ask how much longer do you anticipate being on this particular presentation? Is
I
this an
think
appropriate point that we can stop, or do you
yeah,
want to
it's
finish a
yeah,
little
we
bit
can
more?
no, we can stop. I'd say we'd stop and we'd continue from the next slide in a few minutes. Right?
Okay,
How
can
about
we?
15 minutes, right?
Yeah, let's audience members. I'm going to suggest we have a 10-minute break. Let's keep it to 10 minutes because we spent a lot more time with the pre-test than we had anticipated. If you don't mind, make a quick cup of tea or go to the bathroom. Try and keep it within 10 minutes. So we'll start in 10 minutes time, if that's okay with you. Thank
Yeah.
you, everyone. Thank you, Neil.
No, anytime.
Wonderful, informative session. we're all more refreshed and back ready to resume the lectures. Thank you, Neil, for your activity during this break to respond to a lot of the questions. Thank you for that. So I'm going to hand over back to you, Neil. Thank you.
Hey everyone, I'm back. So I went through navigating the ESPT, where you would, in sequence, first ask what your question is, figure out what indicators would answer your question, what sampling methods would enable you to collect those indicators, what your sites should be, what your sampling design should be, and then how to factor in your capacity and funding. And please note, over the next few days, this is what I will be going over in detail for each one of those little sections. Um, I also started talking about a decision tree. Now, what is a decision tree? So, if I back up a second, so I'm honestly a big nerd, and whenever I have a problem or a question or a study or anything that is posted to me, the first thing I do is try and map out everything I can think about it. And this is really helpful for me because I can understand what is the best way forward, what I have to incorporate. And what I do is make these decision trees. So a decision tree is basically how you would think through something. So let's say there's a decision to do something, and there's the answers are yes or no. Like, should I eat chicken for dinner? Right? No, I can't eat chicken for dinner because there's no chicken at home. Or yes, there is chicken at home. My next decision is, should I cook it or go out? Oh, cook it at home, or is there ready-made chicken, right? If it's cooked, I can just go ahead and straight and eat it. If it's not cooked, I have to cook it, right? And so in the same way, that's a bad example, but I hope you know what I mean. You can have a decision tree that looks at all the processes, right? If I stayed at home to eat chicken, or if I went out to a restaurant to eat chicken, or if I could eat chicken at all. So if your question is, do bed nets work at my site? Or what are the vector species at my site? It's the same sort of process. And even though at the beginning, when you map all this out, it looks like there are so many decisions and things to do, technically, uh, I had chicken at home and it was already cooked. So all I had to do is 1, 2, 3 points, right? It would be much simpler. So there are a bunch of decision trees in the ESPT that map out to multiple questions, and I'll be going through this later as well. So this has already been done, and they've been made by global experts, like a whole bunch of global experts got together to make all these decision trees and validate the ESPT. So this is something easy for you to look at, and you can reference to see, what do I have to do? What do I not have to do? What kind of decisions do I have to make? The next thing is minimum essential indicators. And what I've mapped out here are some indicators, vector indicators. On the left, we have larval indicators of receptivity, habitat availability, habitat occupancy, and larval density. And on the right, we have adult vector indicators, vector occurrence, density, seasonality, and biting behaviors, like where are they biting? Are they biting inside houses or outside houses? And what time are they biting? Are they biting in the middle of the night or early in the evening? Resting location, and as you might imagine, if they're resting indoors, IRS or indoor residual spraying is really important. If they're biting late at night indoors, bed nets can be useful. So understanding what minimal essential indicators to add into your entomological surveillance to answer your question. And of course, insecticide resistance. Now, what's cool about this is when we look at minimal essential indicators, let's say we look at indoor residual spraying. The first question is, how does indoor residual spraying work, right? Because it takes advantage of a mosquito behavior. So indoor residual spraying, you spray the insides of houses with your insecticide, and then you wait and hope that your mosquitoes that are transmitting malaria will rest on that wall. They can rest before feeding, after feeding, usually after feeding, but when they rest on that wall, they get impacted by the insecticide and they die. So you can decrease that mosquito's daily survival, because any mosquito in that population, because any mosquito that rests on the wall will die. So overall, you decrease the survival rate every day. So what are the minimal essential indicators based on how IRS functions? IRS functions on indoor resting mosquitoes and if they are insecticide susceptible. So the minimal essential indicators to collect are just those two. If your question is IRS going to work at my site? I would look and see, the proportion of mosquitoes that are resting indoors, and if that's susceptible to the insecticide I want to spray. And those are your minimal essential indicators. All of a sudden, we've whittled down 40, 50 indicators into just two. And if you collect these indicators properly, if you design your entomological surveillance plan well, you can collect multiple on the indicators for no extra cost that help you understand the system better. You can know your species specific resting. You can look at species specific densities. Can look at seasonality if you do it throughout the year, and then you can understand, oh wait, they are resting indoors. They are susceptible. And I have to go in about May in the season, right before the rainy season when their population goes up, right? Based on vector occurrence and density. And so here you can see how your target minimal essential indicators are resting location and insecticide resistance for IRS, but you can collect other indicators with no extra effort uh, to be able to make your decisions better. And that's an example of minimal essential indicators for IRS. In the same way, we can look at bed nets or ITNs or LLINs, right? How do bed nets function? Bed nets function on indoor late night human biting mosquitoes. So what we'd want to look at is just that. Where are my mosquitoes biting? When are they biting? And since we have an insecticide on your bed nets, we want to look at insecticide resistance. And if you collect your data well enough, you can answer other indicators as well. And in the same way, if you look at larval control, the only thing we want to know is where are our larvae? Where are they so we can treat those sites? And if you collect that well enough, you can do all the others for no extra cost. And so that is a sort of simple way of looking at minimal essential indicators. Now, one thing we all forget, including me for a long time, was whenever we put an intervention into a system, we change transmission. We have changed it the second we put an intervention in. So when we change transmission by ourselves, we have done it. Why do we continue doing the exact same thing moving forward? So we've changed the whole system. We have to adapt what we do and expect changes to push back at us. And the three things we want to look at when we implement an intervention is how do we impact the composition of species? Because we're going to impact some more than others. You know, that species three that was biting indoors with the bed net is going to be killed off a lot. And I'll talk about that in a second as well. So we want to look and see how it's where we are impacting the system. We might have changes in behaviors. For example, mosquitoes that bite indoors and are biting outdoors. And of course, what we always do, look at insecticide resistance, the emergence and spread of insecticide resistance. So the three main things that I see that can possibly change when we implement an intervention and that we need to track are changes in composition, changes in behaviors, and the emergence and spread of insecticide resistance. Now, again, as you all see, I'm going to be using this figure a bunch just because it's just so simple to me and easy to understand for me. So how human behaviors and vector behaviors overlap, there's transmission. You put your intervention, you have protection. The transmission down here is basically your gaps in protection. And we want to understand as much as protection, we want to understand this. And this is something I've said so much. Many times I've been for presentations where people say, we have 80% bed net coverage, 80% bed net usage, or with IRS, we've sprayed 90% of structures. And what they're basically doing is talking about the protections we've done. And my standard question is, you've done all this. I'm really happy. I'm really proud. Great job. But why do you have all this malaria? Right? Where is that malaria coming from? And that is this lower section, your gaps in protection. Where is your transmission coming from? So as much as we want to understand what a great job we've done with interventions, equally important is how we are not protecting people, where all our transmissions coming from, because all that is where people are dying, right? And that's what we want to understand as well. An important thing is when we look at interventions, and this is just a diagram, a pictorial way of understanding all the changes that happen, right? If we have an intervention and you have your vector behavior, vector species, what happens is you can have multiple vectors, right? And each vector, as we talked about, might have different behaviors. So your vector behavior let's say vector A, can overlap completely with your intervention. And so therefore, you're almost completely protected from that vector. Or in vector B might be partially affected. So you can have protection here and transmission here. And like vector C, for example, is the outdoor biting one, just an example, might completely be unaffected by your intervention. So just from this figure, you can easily see in a picture how what your transmission system is with three vectors that have completely different behaviors. Now, just imagine at some sites, there are 24 vectors. Like I work at some sites where there are 18 to 24 vectors, different compositions, they function differently, bite differently. So you can imagine how complicated that can be in understanding. But you can focus on the rest of the major vectors. So when you look at species composition, for example, now you have vector 1 up here that overlaps with your intervention, and vector 2 down here that has no impact on intervention, right? So in your previous figure, in this figure, uh, your vector 1 is up here, and now you implement an intervention. What happens? You're impacting that vector. You're increasing its daily death rate. And your daily, over time, that vector composition, the vector density goes down. So you can see how you can impact of intervention, you change the species compositions and species-specific densities. And over time, you can almost get rid of vector 1, but nothing happens with vector 2, right? So you can have, oh, I don't know why my slides are repeating here. Apologies. Uh, so you can have over time, you can change the density of vector 1 to just a small amount, but vector 2 remains unaffected. And you can see in this space here is where you are going to have transmission, and this space here is where you're going to have transmission. And understanding that is important to protecting people. Now, when you look at species-specific behaviors, over here we have vector 1. Let's say it overlaps a lot with our intervention. And if all these vectors in this space are going to get killed off, right? Hopefully. So therefore, we are looking at vectors in this space out here that will basically survive. To go have babies will basically survive. So imagine if there's a genetic component for indoor biting or resting on walls, right? We're selecting for those mosquitoes that will be affected by our intervention. So over time, what happens? Your vector starts changing behaviors. And over time, they might completely avoid your behaviors. And there are actually sites and places where we've seen this. For example, in the Solomon Islands, where the vectors used to bite in the middle of the night. And now your vectors are basically biting early in the evening. And they've changed their behaviors. And so your intervention is not that effective. And this is where entomological surveillance comes in, right? To map out your species compositions in the previous example, as well as their behaviors. Now, if we look at insecticide resistance, the third way that things could change, here we have a susceptible mosquito. And what happens is your intervention basically gets less effective, right? Because your mosquitoes are getting resistant and your intervention basically moves away, where eventually your vectors might be completely resistant. And here your intervention's functioning there and it's well implemented, but your vectors are not impacted. So just in these pictures, I hope they were clear, you can see how you can impact species compositions, their behaviors, and insecticide resistance. Now, when you look at the ESPT, and actually I have a slide on it later on, there are multiple tables in there where a whole bunch of people have got together and helped work on them so that we have all this already thought through for you. So if you look at your left side, you have your indicators like vector occurrence, vector density. And if you want to see a minimum indicator list to determine whether an intervention may be effective at your site, right? It's different to say, will my intervention be effective? And is my intervention effective? One of them is for before you implement your intervention to find out if it will be effective, if it may be effective. And the other question is after you implement your intervention, is it effective? And both those are completely different questions and may require completely different strategies and indicators. And so over here in table number 6 in the ESPT, we actually map out the indicators to understand whether an intervention may be effective. On the top, we have bed nets. We have PBO bed nets, L lines, PBO L lines, insecticide-treated hammocks, indoor residual spraying, larval source management, and all these mapped out here. And over here, down here, is the indicators you might select to understand that, if they may be effective. The greenish blue colored cells are those ones might be used. Depends on the ingredient, of course, is for these resistance frequency, for example, for ATSBs. So all this is already thought through for you. The minimal essential indicators are above, and supplemental indicators, which might help us understanding if we have enough money, are below here. And you can reference this based on your question. If you look at table 8, we use sampling methods. Oh, just as a quick note, I'll go back a slide. Table 7, which is not over here as an example, is minimal indicators to determine if an intervention is effective. So after you implement it. So we have a table for before you implement and after you implement. We also look at tables for sampling methods, right? Can we use sampling methods to understand a specific question, to collect an indicator to understand a question? For example, here are the sampling methods: human landing catch, human baited traps are all listed out here, and the mosquito behavior that the method takes advantage of. If you remember, interventions take advantage of a susceptible mosquito behavior. So do sampling methods. So you have to pick your sampling method based on the behavior you're looking at. And so that's mapped out over here. Your host preference is mapped out here. And then is the sampling method appropriate to collect data for these indicators? So you can see this is also mapped out here. These sampling methods can be used to collect these indicators, for example. And examples of sampling methods on our right. So when you're working through this, or if you don't have the background for this, this is all thought through for this. You can already just reference it. The ESPT is available in multiple languages, in English, French, Portuguese, Spanish, Farsi, and Lao. There is also an ESPT ICT, which is Information Communication Tool, which we will use on day 4, which is basically you work through it online. You work through the whole question online, and it helps you make decisions, and you can work through it. Please note that the ESPT is about 80 pages, 80 pages. And I was part of writing it, and I do not want to read it. It's too long, right? When you're working, do you really want to sit and read 80 pages of work? So that's where the ESPT ICT comes in, where you can just work through it online. And this was developed with Liverpool, the Liverpool School, and it's available online for free, of course. And I can tell you where to get it on the next slide. To download the ESPT, please Google ESPT MEI, and you can download a PDF version of the ESPT. The electronic version, or the ESPT ICT, which you can work through, is also available on there. And I'm asking you to please download the ESPT and flip through it if you have the time tonight or tomorrow morning before the course. And also look through the little ESPT, the information communication tool, the online version, and sort of make sure it works on your computer. There is both Mac and Windows versions. I'll be using the Mac version since I'm on a Mac. They look the same though. When you Google ESPT MEI, you should get to this page, and then it'll ask you what language you want to download. And if you wanted to download the Mac version of the little ESPT ICT, you click on that. If you want to download the Windows version, you click on that. All this is, of course, free. And it would be really great if you sort of glance through it. And so you're ready for working through this in 3 days on Thursday. In addition to that, we have YouTube videos done. They are narrated by Mercio Pio, who is part of our team. And do I have an example of working through this? I don't think so. But if you look at YouTube, there is a YouTube video of how to do this. So you don't have to listen to my voice. Mercy has a much nicer voice than me. You can go through all of this with Mercy online at your own time and leisure. As well as you have any questions over time for the ESPT, feel free at any time to email any of us. Since we are sharing these presentations and these will be recorded, our emails are on there. This is Steve on the left. He lives and works with us in Malawi. This is Mercy, who lives and works with us from Mozambique. This is Elodie, who lives and works with us from Switzerland. And this is Eddie, who lives and works with us from Atlanta. And I'm in the University of Notre Dame in South Bend, Indiana. So we're a pretty global team. We work together on the same team and we're all over the place. But we're all happy to talk to you all and answer questions at any point. Please feel free to email any of us that you prefer. And that was my quick ESPT presentation. Does anyone have any questions? Did anything pop up in the chat?
Indeed, Neil. So
Oh,
I've been trying to respond as we're going.
oh, sorry.
Neil, if you go to the Q&A box, there are still 3 unanswered questions that popped in very
Yeah,
recently. Maybe you just want to read through those?
yeah. Uh, so the first question I'm reading through is which indicator will be taken in malaria elimination settings? In some setting, the vectors have been ignored in set settings, and why? You are correct. So in most elimination settings, people focus on the disease, on malaria, more than the vectors. Because at that point in time, when you're close to elimination, it's easier to find a malaria case than to find all the mosquitoes transmitting malaria, to find that infected malaria. Because you can have a lot of mosquitoes in an area and no malaria. You can have a lot of anopheles and no malaria, as we see in the US, for example. There are lots of anopheles, but no malaria. So in this situation, very, very few of them are infected with malaria. So people tend to focus on the disease more. But to your point, are vectors important? Absolutely, because they are transmitting the disease, right? So can we figure out, the question would be, can we figure out where and when people are actually getting this disease? And for that point, you might want to follow the actual infected people, right? Because there's so few of them, to figure out where and when they're getting them so that we can prevent more transmission. I hope that answered that. Uh, should we use vector control like IRS or L lines? It's more like protect us. Uh, I'd say so. Since we're looking at this programmatically, I would say yes, bednets and IRS have documented evidence of protecting populations. They don't have personal protection, but also community protection, where if enough of people have an intervention, you're not just protecting yourself, you're also protecting your neighbor without an intervention, because you've either reduced the mosquito population or the population age structure, so less of them are infected. So even though you may not be using it, you are still protected because your neighbors are using it. Yes, so I would suggest yes. If you live in an area with malaria, try and use your bed nets and try and use IRS if it's provided by the country. We request that other countries' medical entomologists make group for exchanging information. Absolutely. Actually, Leo knows this, where we've had a couple of other trainings where we have WhatsApp groups where we still, years later, 4 or 5 years later, we are still discussing questions, sharing information, sharing lessons learned. Yes, this would be a very, very useful thing. Uh, are AI-based platforms useful for vector surveillance? If not, uh, if yes, what minimal indicators? So AI has artificial intelligence has just recently, people are trying to use it to understand things. I don't know if people are using it on a large scale at present. I don't know. But I do think modeling, which helps us understand what's happening from a modeling perspective, when we don't have all the data, when we want to understand, for example, will spatial repellents work at my site? We can model the impact of spatial repellents based on site-specific data. So I'm sure AI will pop in at some point, and I'm sure it's already being used, but not in my group. So I'm sorry, I can't answer that question more. Uh, so malaria transmission is different from dengue transmission. Uh, and can you predict this using entomological indicators? You are correct. And the reason why malaria is different from dengue is because they're different vectors, and the vectors have different behaviors. For example, Aedes usually bite in the evenings and mornings, more during the day than at night, whereas Anopheles bite at night. And that completely changes your transmission because humans are doing different things at those points in time, and they're at different places at those points in time. An example, for example, Aedes aegypti also doesn't fly very far. It doesn't fly great distances, but Anopheles will fly great distances. So based on that, you can actually almost eliminate Aedes from an area and they won't come back for a while, but Anopheles will come back like that because they fly great distances. What about repellents? So many questions. There's questions. Repellents, yes, spatial repellents. So right now, actually, I have a couple of slides on that later on. They are in PQ evaluation right now. With so the WHO is actually spending a lot of money, not WHO, institutions are spending a lot of money to try and evaluate spatial repellents to see if they're useful for malaria control. And so far, the studies are not complete. But the data that I have seen, I'm giving a thumbs up, which means that spatial balance will probably be approved by WHO for ministries to use. And there are several large projects involved in that. There was a project in Indonesia that showed some impact against malaria. In Kenya, Mali, as well. For dengue, there was a really good project that showed impact in Peru. Uh, and I was part of all those projects. And at present, there's a large Unitaid project funded. I'm part of that as well, to try and understand how to get spatial repellents to populations. What do we need? If spatial repellents are approved by WHO, all of a sudden they say, yes, we approve them, but what do we do at the next, right? How do we make sure all the systems are in place where countries can actually select, make sure it's useful, and then how do we get them to people? What are the regulations, storage conditions? What systems do we need? So that's another project we're working on.
Neil, before you carry on, I'm not 100% sure whether you're done for the day in
Oh no, I'm not. I should stop. Yes, I'm getting
Okay, yeah.
the
I'm sorry,
question.
that's my mistake.
Fine.
I just assumed that you were done with the lectures. I
No,
think because the questions are now people have seen you responding, so
yeah.
there's a flood of questions
Oh,
coming
yeah.
in. So
I'll stop.
let's park the questions for a minute, and you continue, please,
No,
Neil.
you're absolutely right. Thank you, Leah, for that. I get lost in the details sometimes. So we might not have time for all my presentations today, but this next one I think is important, and I think this might get you thinking in how to actually function. Gaps in protection. This is where all our malaria is coming from. So what is a gap in protection? Remember the figure that we went over 200 times just now? A gap in protection is a circumstance where someone or a household is exposed to malaria infection, to an infective mosquito bite, basically. And this is because there isn't an effective or adequate protection. Like they don't have a bed net, or they don't use their bed net, or the mosquitoes are biting outside that space, right, where the bed net is effective. So gap in protection is anywhere basically that's not protected. And this is a term we've been using a bunch because we feel that's so important to understand, both in terms of space and time. Where and when are people getting exposed to malaria? In addition to how we can protect them. So what is a driver of a gap in protection? For the current core WHO recommended interventions of bed nets and IRS, a gap in protection, for example, can include insecticide resistance, right? Your mosquitoes are resistant. It can contribute to more mosquitoes and more mosquitoes biting, infected mosquitoes biting. It can be vector species specific behaviors, for example, as someone mentioned, outdoor biting or outdoor resting. If they're resting outdoors, IRS is not that effective. If they're biting outdoors, you can't walk around with a mosquito net around you all the time outdoors, right? So that's a gap in protection. Human behaviors, for example, if they don't use their bed nets in that picture, where is the little baby sleeping outside a bed net, right? If humans are outdoors, that's also a gap in protection. So it's important to understand how your intervention functions in your space, in your geography, how your intervention, your humans, and your vectors overlap, because that'll tell you your gap in protection. Now, over that, we want to overlay things like infrastructure and monitoring and evaluation systems. So a gap in protection can also include the fact that you didn't give everyone a bed net, right? Or you couldn't reach some communities. Or your IRS sprayers, your sprayers of insecticide and walls for IRS, they didn't do a good job. That's a gap in protection. If people refusing to have you spray their houses, that's a gap in protection, right? And when we look at drivers of gaps in protection for the current core interventions, which are bednets, IRS, and LSM, what about the new ones coming up? Someone just asked about space repellents, right? What are the gaps in protection with those? So understanding what the gaps in protection are really is really important because that tells us where our malaria is coming from. And here's an example using ITNs, right? We all always talk about how ITNs work. And how do ITNs work? ITNs work on late night indoor biting mosquitoes because that's where we put our bed nets, right? That tells us the proportion of biting that LL lions can reduce. Now, from the human side of things, humans have to be indoors and under their bed nets to be effective, correct? That's a proportion of biting LL lions can target, right? Now, mosquitoes have to be susceptible to the insecticide for LL lions to have a community impact. So we have how the intervention functions, how it functions with humans, and how mosquitoes function with that intervention. And that's how bed nets work. Now, what's the opposite of all this? What is the flip side of all don't work? So here is something that I would ask you to do, not just evaluate everything on the left, but if you do it well, you can also evaluate everything on the right. Bed nets function on late night indoor biting mosquitoes. Bed nets do not function on early evening or outdoor biting mosquitoes. Bed nets do not function when mosquitoes are not under their nets. Oh, sorry, when humans are not under their nets. Bed nets do not function then, right? And if mosquitoes are resistant to the insecticide, that's also a gap in protection. So this is sort of the flip side, right? How things are working, how things are not working. On the left is where you're protecting people. On the right is where all your malaria is coming from. And from a programmatic perspective, don't you need to understand that? We need to understand where is our malaria coming from. And quantifying this and measuring this in terms of space and time is really important. And that's what will tell us what to do, what we can do, what we cannot do. So how do we identify gaps in protection? Exactly as I just mentioned, right? We look at how is your intervention functioning, right? How our present intervention functions with our local vectors, as well as how interventions don't work. So based on your question, if your question is, are bed nets, what are the gaps in protection with bed nets, right? We want to understand how bed nets don't work. And we can design that question in terms of essential data to collect to answer the question. And I just went through this on that previous slide, right? Those are the minimal essential data to collect. And then we can integrate this data with multiple other kinds of data to understand it from a global perspective. We can look at human behavior. When are people indoors? When are people outdoors? When are they under the nets? When are they not under nets? And a lot of the time, we think of this as being a lot to do, but we can collect this with no additional funds. And I will be talking about this. So we will go over that. So we can collect this comprehensive, really informative, focused data set with minimal essential indicators and understand both how things work and how things don't work. And I'm going to go over this example, and hopefully I can get this done in time, and we'll probably stop after that, of Cambodia. And one of the questions was outdoor transmission and transmission in forests. And I'm using this as an example because it just worked so well when we were trying to figure it out. So what we wanted to do in Cambodia is where this is Cambodia on the right. I hope there are Cambodians in our group. Please say hey in your chat so we know that. Uh, if you can think, so what we want to do is have appropriate and acceptable and effective tools. We want to deliver them to the right people, to the right places. And so we were working here in Mondulkiri where this circle is. Oh, I think I moved. The circle moved. I'm sorry. The circle should be by this red area, not the green area. It should be by the red. The circle moved, unfortunately. Um, and in Cambodia, what happens? All this residual transmission is in forests. And it's in people who live in structures that are basically tarpaulins, and they sleep under there. Or it's in forest rangers who travel through the forest wildlife to protect wildlife. And they are the ones who have malaria. People who also get malaria, people who live in the forest dwelling people. So what we wanted to do is understand where and when people are being exposed to malaria to try and understand what interventions would work there. And please note, Lordy, what am I saying? As a note, uh, we are looking at interventions that are not necessarily WHO recommended. We wanted to look and see what was available and what people might use there. So Cambodia wants to eliminate malaria, as I said, and now my circle is in the right spot, and that is where the study occurred in populations who lived like this. Since they aren't traditional structures, we cannot necessarily use IRS. People use very little bed nets, and in fact, it was really funny. The people there, if they used a bed net, the other people made fun of them, like, "Oh, look at you using a bed net," which was human behavior, right? Humans were actually lowering bed net use that actually protected them. So remember this figure again, you're going to see this a lot. What we wanted to do is understand both protection and gaps from protection. And since there might already be some interventions in use, we wanted to see what interventions they were using and if we could add an intervention to it, right? So if we have intervention one and intervention two, we can further protect people. And so there'd only be transmission in these areas over here, based on the figure, of course. So can we layer interventions in this area to see how to protect people? So we wanted to see in this forest transmission system, what people were doing, where they were doing it, when they were doing it. And at the same time, we wanted to see what mosquitoes were doing and how do we overlap an appropriate intervention in those spaces and times, right? I hope that makes sense. So here's what we did. What we realized that there were three main areas where people were functioning. One of them was when they were functioning in and sleep, places where they slept in like the tarpaulins and little huts, open structures where mosquitoes could fly in and out. They were sleeping there. Then they were also hanging around outside these spaces. And in those spaces, they were eating, they were drinking, they were hanging out. Then they were also working in these forested areas where they were doing multiple things, cutting wood, collecting mushrooms, anything you can think in the forest. So we mapped this exposure, space, and activity to different interventions to see how they would work. So in this first place, in these temporary structures or sleeping spaces, we thought of we could use space repellent, a passive volatile pyrethroid space repellent, or a VPSR. And these are just things you hang up and they are space repellent, so they protect that space. We also wanted to see how a space repellent spray might work. And I'm sure you might have seen sprays that you just spray in the air and those work. And since there's no electricity there, we could not use any electrical devices. We wanted to look at insecticide-treated clothing and topical repellents. Topical repellents are repellent creams that you put in your hand or in your face. And these were selected based on interviews with the communities and things that we thought might work. Would you like this? Do you like that? Maybe you'll use this, maybe you'll use that. So we wanted to approach communities and see what they would approve. Because of course, if we said something that they had to use, we told them they had to use something that they did not like or did not want to use it, it would be useless. Human behavior is supremely important in transmission. In these spaces, when they were outside, we realized that the passive VPSR, space repellent, would work, the space repellent spray would work, treated clothing would work, and the topical repellent might work. And in the forest, your treated clothing would work and your topical repellent would work. And we thought, what if we give them a package of all these interventions together and told them and had SBC material, a social behavior change material? Uh, what if you use these interventions in these spaces and times? This is what would work. And so we mapped out where there was no protection, where the gaps in protection were in these three spaces and times, and we overlaid that with what we thought would work in those spaces. And what we did then was we did a study, and these are what we actually selected. So we had these forest packs and we evaluated these products. One of them was a passive volatiles spatial repellent, and you can see the little sheet out there. It was impregnated with transfluthrin, and it emits transfluthrin and protects the space. This is a picture from a semi-field evaluation of it. Then we also used a spatial repellent spray. We use Outline, which is a topical repellent. We use insecticide-treated uniforms for the forest rangers because they had to wear uniforms. We treated their uniforms. And please note that since the uniforms are long sleeves and long pants, which were different from what the community used normally, which were like short sleeves and short pants, we evaluated both of them. Because if you imagine, if you're wearing short sleeves, your mosquitoes can bite you on your hands. And that's what we realized when we evaluated it in the semi-field system, that treated clothing worked against every area of the body where the mosquito, where it was protecting from mosquito contact. But your hands were available, and the mosquitoes would bite you on your hands, which is why we always paired our treated civilian clothing and our treated ranger uniforms with a topical repellent. And this is based on data. So this is the area where we evaluated uh, this package of interventions. As you can see, it's in an area that's very close to a forest. Each of these tents had a different intervention in it, and one of them had all of them in it. And we rotated this, it's called a Latin square, because we wanted to demonstrate and try and measure how much mosquito landing we could reduce. So we had one with nothing, each one of them had one intervention, and one of them had all. And that black tent way in the center is where I slept. We all slept, actually, the core team slept. And this is what we found. Now, over here on the left, we can see cumulative anopheles. So in day one, how many did we find? We'd add that to day two, add that to day three, add day four to it, cumulative anopheles for each one of those interventions. And this is the number of days. If we did this for 49 days, we can see that in the control, without any intervention, we got about 3,537 mosquitoes. Now, ETO stands for etofenprox treated ranger uniforms. What we did is we evaluated freshly used ranger uniforms, which is a 0, and we washed them 20 times to see if we got rid of, if the efficacy went down. And of course, both these were with topical repellents. Those are the blue ones, fresh and washed. And this is civilian clothing, fresh and washed. And as you can see, all these four protected people quite a lot just by themselves from landing. And over here, 124 was all combined, all the interventions combined, which is a treated uniform plus the volatile pyrethroid space repellent. And 138 was a space repellent. And this amazed me because just with the volatile passive space repellent, you could reduce the number of landing from 3,537 to 138, which is almost 95%. And of course, combined, it went down even more. And this was done, right, based on looking at gaps in protection and what might work in those gaps. So overall, all 6 interventions and their combination significantly reduced mosquito landing by at least 50% and up to 94%. Alone, VPSR, this volatile pyrethroid space repellent, and the combinations of all of them together worked really well. And this is where we can see how mapping gaps in protection and how things function, the mosquito, your vector, and your intervention, can actually produce data that can point to really good decision making. So after this, the Ministry of Health of Cambodia actually wanted us to do an implementation study, which we did, and we actually got pretty good data from there, where we understand how the communities interacted with this, because this was a controlled study. We then had to map it out to how communities would work with these interventions. And so all those are being analyzed and being published right now. But I hope this was a good example of how gaps in protection function. So all this is, of course, ideal. And the reason why we did it in communities, evaluate in communities, because let's say in our studies, let's say the combination got 80%, even though we got 94% reduction. Let's say the combination got 80%. What happens in reality is that there are multiple things that reduce effectiveness. So we got an efficacy of 80%. Let's say provider compliance is 80%, access is 70%. Your people use it not so well. Maybe 75% of them use it well. Targeting some of your vectors, only 75% of your vectors are impacted by it because, vectors have different behaviors. Then your field efficacy is 75%. And in the end, your effectiveness only gets to 20%, right? Even though in our field study, in our control study, we got an efficacy of 80%. When you actually work through what happens in an operational system in actual communities, you'll get a much lower effectiveness. And understanding this process and our gaps in protection over here can help us optimize it to get this 20% much higher. And that's where, again, the ESPT and entomological surveillance comes in. And when we look at gaps in protection, don't freak out with this slide. It's scary. You have your vector-related gaps in protection, your each intervention. So there's LSM here, IRS here, bed nets here, and they overlap as well. And then you have your human gaps in protection, and you have your drugs and treatment-based gaps in protection, and others, rainfall, weather patterns. And then you also have national policy. And overall, there are so many things you can look at that actually reduce protections. And that's what we sort of want people to do. Try and understand how things are not working versus how they're working. And I'm going to have a quick sip of tea. Ah, so the blue bed nets and IRS are WHO recommended right now. And LSM down here, larval source management, is a supplemental intervention. At present, spatial repellents are in the pipeline as a new intervention, and hopefully this will be approved, and we're going to have to develop all the processes to actually implement this and understand where and when they're going to be effective. Endectocides are in evaluation. Two trials were done. Endectocides treat mosquitoes. A mosquito that bites a treated animal or a person will die. One trial was successful and demonstrated impact, the other did not. So at present, we're unsure if another trial will be funded. ATSPs, or attractive targeted sugar baits, or attractive toxic sugar baits, depending on who you talk to, is where mosquitoes will feed on an insecticide-treated sugar source, sugar meal, because as you know, mosquitoes feed on sugar as well, and that will increase their daily death rate or kill off quite a few of them. The present trials for ATSPs I've not demonstrated great success, but let's see what happens to them. And then now the transgenic mosquitoes or genetically modified mosquitoes, and that may take a while to be approved. But these are what are being evaluated right now. I think we can also add in eave tubes as well. There's a trial for eave tubes to prevent mosquito entry into houses. So these are the present interventions to try and understand how they function and how they don't function. So I'm going to quickly go through these last few slides. If you have bed nets at your site, ask yourself these questions. Right, how do bed nets work, first of all? How would you assess how an intervention would be useful at my site? And once I implement it, how would I measure its effectiveness? Right? What other things might change over time after I implement interventions? This intervention, what might change? For example, the mosquito species composition, their biting behaviors, when they bite, where they bite, right? And then the flip side of how bed nets work, how do they not work, right? What are the human drivers of gaps of protection, the vector drivers of gaps in protection, other drivers of gaps in protection? So I'm asking you, whatever your intervention is and whatever you're working through in your country with your position, ask yourself these questions so you can think about this comprehensively. And now the same exact set of questions are pretty simply. I put the slide up again for bed nets. This is the simplest way of looking at it, right? You can see as an example that I already went through how they work, how they don't work. And then do the exact same thing for IRS, for indoor residual spraying, which is WHO recommended. How would you assess it? How does it work? How does it not work? What other things cause gaps in protection? Human, vectors, right? Ask yourself these questions, think about them. Larviciding, the exact same thing. How does it work? How does it not work, right? What is the potential? And new interventions coming up with like spatial repellents, the exact same questions. Ask yourself these questions. Can I use it? Will I use it? Like, how effective is it going to be? And then overall, this is sort of a systematic way of looking through it. At least this is how my brain functions. What are the gaps of protection at my site? The kinds of data I would need is how does the intervention function, the mosquito behaviors that it takes advantage of, and the human behaviors that might impact how effective it is, right? And this will tell us where and when the intervention is protective, where and when it slows down or stops exposure. It also tells us where it's not effective, what the gaps in protection are, or GIPS. I just made that up for this presentation, GIPS. And when you understand protection, you can understand your intervention effectiveness and how much malaria you've gotten down, and you can relate that to epidemiology. And you can also understand how to optimize your intervention, right? How to make this protection much higher. And that also comes from your gaps in protection. You can understand the sources of residual transmission, as well as what new interventions are required. For example, if your intervention, uh, let's say bed nets only get 50% of transmission and the rest of the transmission is still outdoors, what interventions might you need outdoors? What is your target human population doing? Are they living in forests? Can you implement spatial repellents or insecticide treated clothes, things like that? This data will tell you what you need, what you have, and it'll overall comprehensively tell you the good and the bad. And this is a saying that a friend of mine told me that I think is so important. A long time ago, when DDT started being used, people took DDT and just gave it to the programs and said, implement it. Spray DDT everywhere. And people were trained to be problem solvers. They just took the DDT and sprayed it and expected to solve the problem. But now, uh, I'm sorry. I'm totally mixing this up. This is I mixed up the quote that I follow all the time. Before, with DDT, people were told this is the solution. This is DDT. Just go spray it everywhere. And people were told just implement the solution. They were not asked to think about this. They were not asked to solve problems. They were just told, here's DDT, spray it. And that's what people started doing. They just started giving everyone bed nets. They started doing IRS everywhere, started doing LSM blindly because that's what they were told. That's what WHO says. But I'm thinking, we should be thinking, before DDT, how malarians were thought. They were thought to be problem solvers. What is the problem? How should we solve it? Are bed nets actually working? What are the gaps in protection? How can I deal with those gaps in protection? How do I optimize my intervention? So these understanding what the problem is and solving that problem is what we need to do now. We need to be problem solvers and not solution implementers. And I think we need to change how we think about malaria transmission right now. And this was by Jose Nahera, I think that's how you pronounce his name, who is a former WHO epidemiologist. And I'm sorry for messing up this quote that I think is so important. And that was the end of my slides for today. I think I'm 5 minutes over time, and I'm happy to answer a few questions, and we can start up with the next sessions tomorrow.
Neil, sorry.
Yes.
Yeah, so I'm struggling to activate my video, but it's not important to have the video on. At least you can hear me.
We
So,
can see.
okay, there's the video as well. At least to see the beautiful background of Java, Central Java. What a beautiful region. So, Neil, I hope I'm speaking on behalf of all the participants in thanking you for that absolute wealth of information you shared today in a very easy to digest and assimilate way, thoroughly enjoyable. What a great way to learn and improve your understanding about a topic have it presented in such a logical, easy to understand way. So from all of us, a very sincere thank you for sharing your accumulated experience and wisdom for us all to benefit from. Of course, it's not the end. We've still got 3 more days to go. And, if we've learned so much on day 1, it shows how much we are still going to benefit and learn from. I'd also like to use the opportunity just to thank Wulan and Dr. Porn for, in the background, the technical support that they have been providing. But most of all, to our participants, our audience from all over the world. At one point, just now and then, I check how many people are listening in. I got to about 573 people that were listening in. So a good audience, and I hope you all enjoyed it. And I hope all of you will be back again tomorrow, again at the same time for another 2.5 hour session. So thank you all. But Neil, if you have time, and if our audience members can link in for a little bit longer. You want to go to the Q&A box and
Yeah,
maybe take 3 or 4. You don't have to do all of them, Neil, but just 3 or 4. Then I think that would be helpful.
I will work through from the bottom up.
Okay. Yeah. Excellent. Thank you, Neil.
How will the range of every intervention impact on the second intervention when used in combination? So I think this question asks, how do combinations of interventions work? That's a great question. So combinations of interventions work based, as I said mentioned earlier, based on how mosquitoes function with that intervention. So if they different interventions work in different spaces and times. There have been a few studies on this, not too many. You might be able to look at PubMed to look at interventions, how bed nets function with IRS and things like that. And WHO has specific recommendations on that. Like they don't want two interventions to have the same active ingredient or the same insecticide because you can promote insecticide resistance development. At least that's the theory behind it. But it's expected that two interventions that work together in parallel on different behavioral aspects of the mosquito should have a bigger impact than just one. I hope that made sense. Yeah, that's the expectation. Uh,
Excellent. Thank
yeah.
you.
How to identify gaps in protection at points of entry, such as seaports. Oh, this is a great question because this is, for example, relevant to invasive species like Anopheles stevensii. And I know a bunch of people actually working in this right now. So the gaps in protection, it's hard to define that in terms of invasion of mosquitoes. Uh, because they basically come and fly there and they hang around there and they hope and they can maybe breed and increase their populations. But we're probably looking at gaps in protection in regards to transmission, in which case we're going to have to understand how those species of mosquitoes behave with the local humans and with interventions. And there are a few projects on, for example, Anopheles stevensii going on right now in Ethiopia, trying to understand what Anopheles stevensii is doing, what their behaviors are, and what interventions might work in those spaces. I'm involved in some of those studies too. Uh, can we use different interventions in the same area? The easy answer is yes. Uh, Overlapping them, WHO has specific recommendations for that, as in the type of insecticide, as I just talked about. You don't want to use too much of the same insecticide because you can promote the development of insecticide resistance. But yes, multiple interventions in the same area can target different mosquito behaviors, and you can have a greater impact on uh, the survival rate and therefore decrease malaria more. Again, there are not that many studies. And one point I would say is that if anyone were to implement all these things, I would definitely recommend trying to document everything and publishing it and doing it in a way where you can have really good evaluation. So the lessons you learned, once it's published, other countries can learn, and WHO can actually use those for making recommendations. A problem is many countries do a really good job of multiple interventions and combinations and LSM, but none of it is published, which means uh, basically, if it's not published, it never happened. No one can learn from it. So understanding what other people did and publishing it, it would be a really great thing to do. And of course, there are multiple people who will be happy to help you with that. I'm trying to look at more questions. In the context of recent outbreaks of vector-borne diseases, how is entomological surveillance typically implemented to manage and control these outbreaks? Great question. So let's say the main reason for doing, when you have an outbreak, your first thing you want to do is reduce your transmission, right? You want to reduce the number of mosquitoes carrying your disease or find the people who are infected and treat them. So in a weird way, epidemiology and oh gosh, entomologists around the world are going to hate me for saying this. In outbreak situations, uh, epidemiology might be slightly I, more important, slap me now, more important than entomology because epidemiology treats the people, treats the human reservoir, uh, but your entomology stops onward transmission. And when we look at entomology, we're basically trying to find out the gaps in protection that has resulted in this outbreak. Exactly what I said before. So what we want to do is find out the main intervention that would impact onward transmission with that outbreak? And this is a really good question because an example is larviciding. A lot of times with malaria outbreaks, people do larviciding. And one reason why I would say we may need to step back for a second and think about why we're doing that is because think about this way. There's an outbreak. There are infected mosquitoes flying around right now. There are infected people that are infecting mosquitoes that are hanging out in that area. And our main thing we want to do is stop onward transmission right now, today. And if we do larviciding, think about how larviciding works. Larviciding works on larvae, not on adults. So you larvicide the entire area, right? There are still mosquitoes flying around infecting people. There's still adult mosquitoes biting humans, getting infected and transmitting more malaria, right? Uh, and larviciding, let's say you treat larvae today. That means larvae take 4 to 5 days to emerge. They take a day break. Then let's say they bite an infected person and they take 10 to 14 days to develop, be infectious. And then those mosquitoes take, let's say they bite another person then and they infect that person with malaria, and that person takes like what, 6, 7, 8, 10 days to actually demonstrate malaria, to have malaria symptoms. And so that's almost 28 days. That's almost a month. So when you do larviciding, you expect an impact in a month. And in the meantime, those 28 days or 25 to 30 days, there are a bunch of mosquitoes flying around with malaria infecting people, right? So what is the most appropriate intervention for outbreaks? It might be things like give everyone a bed net, do IRS, but at the same time do larviciding, which would be more of a longer term over a space of a month impact, right? So think about things like that, how to impact what is your question? Your question is, how do I deal with an outbreak, right? What is your impact question? How would you solve it?
Neil,
Yeah.
I think, we owe you a break. You've had a very intensive session. It's only fair that you should also unwind a bit, take a deep breath and chill out and prepare for tomorrow's session. So again, on behalf of the audience, sincere thank you to you. Also again to our audience, thank you for joining in. We hope you enjoyed it and we look forward to your participation tomorrow. Thank you, Neil. Thank you, everyone.